session.
Hello, I'm Mallory. I'm an OTA student, and I'll be working with my patient Mary today. Mary is a teenager who has autism. She's nonverbal, and when she gets hurt, she does not cry. So, for our assessment today, the materials that we'll need are a safety pin, and also it's good to sterilize it with rubbing alcohol before using it. So we're doing that. And we also have 2 sheets of paper, a happy face, and a sad face. So, the test that we're going to be doing today is a pain sensation test, where we'll be testing for sharp and dull sensation that we'll be doing with the safety pin. So the reason for using this test is to see how well the patient can distinguish between the 2 types of sensation, one being sharp that will feel slightly uncomfortable, and one feeling dull that really has just a normal feel and should cause no discomfort. So to test to see how it's important to do this so the patient knows what is dangerous to them in their environment. So if they ever do hurt themselves, they know to either check it or notify a caregiver so that the injury does not go unknown. So since Mary is nonverbal, we're going to be communicating through sheets, these 2 sheets, happy and sad. So I'll just show Mary how the test is going to go. I'm going to be testing, this is the sharp side, and then this is the dull side. And I'll position her correctly. Her arm should just be on the table like this. Perfect. It's good to have good posture as well, and she's demonstrating that, so that's good. So Mary, this feels like the sharp sensation, and that'll be for this face, the sad face, and then this is the dull sensation, which will be for the happy face. And I'll be going proximal to distal. So I'll be going random spots of her arm and just ask her to choose the sheet that correlates with the correct sensation. So, this will help identify impairments and functional limitations. For the areas that are impaired or absent, I would make note of where those areas are and see if it's following a certain dermatome. But now I'll get started with the test. Okay, so very good. So, directions for interventions following the treatment. I would continue to do more assessments to obtain their functional limitations with detecting pain. So more sharp and dull tests. Also activities that help them match emotions to a certain setting. This patient is nonverbal, so it's important to help them communicate how they are feeling, and we can do that through face puzzles by matching the correct facial emotion with a certain environment that is there. Also texture and feeling bag use, where they would be able to match a texture with a certain face with an emotion. Oh, I'm sorry, match like, so sandpaper would be uncomfortable, and then a cotton ball would be the happy face. And I would also want to provide caregiver education on how to supervise the client and ensure safety at home. All right, thank you.